Welcome back. Moonlighting doctors have been accused of ripping off a single medical aid company to the tune of 22 million rand. Now, it's believed more than 100 KZN doctors were doing private business when they should have been attending to patients at public hospitals. Investigators have now called for criminal charges to be laid against them. Let's unpack the issue with Kgosi Letlape from the Medical and Dental Board within the Health Professions Council of South Africa. This is a slap on the face of millions of South Africans who rely on public health care, isn't it?
Yes, it is. But we just have to put things in context. This is allowed in terms of the Public Service Act. They have RWAPs, which is remunerative work outside public service. The challenge is capability to manage it properly. And the Medical and Dental Board is concerned about the abuse of this system, which was proved essential because the salaries that full-time doctors and dentists get is not sufficient. So it's a policy framework from government so that the doctors that work there can elect to earn extra income by doing private work. It's allowed. The problem is administering it. The problem is also unintended consequences in terms of service to the public.
It's allowed, but is it ethical? You see so many long queues in state hospitals. There are claims of negligence to the tune of millions of rands, allegedly at the hands of doctors, and they're being blamed because they leave the patients unattended and go work in private practice.
Whether the practice is ethical or not, it's what the employer elects to do. But the ethics is about the doctors in terms of the code that we have and code of conduct from the Health Professions Council is that they cannot abandon their patients. So if there can be a case to prove that a doctor has abandoned their patient, the doctor can be reported to the Health Professions Council and the Health Professions Council will look into that matter. But as to whether RWAPs is an ethical or unethical practice, it is a policy of the employer. Our concern as the Medical and Dental Board is about the conduct of practitioners. And just remember that not every doctor in public service abuses the system. Some of the doctors in the public service elect not to do it for exactly the same reasons that you are purporting. And those doctors that sacrifice, that will not do RWAPs, are not being paid any extra, but they are committed to public service and to the service of their patients. And there are many, many doctors that will do it properly as well. But for the ones that abuse the system, we would like to urge them not to bring the profession into disrepute. We'd also like to urge provincial governments to increase their capability of administering RWAPs. And any cases of possible unethical conduct should be reported to the Health Professions Council.
One of the ways that this issue can be dealt with accordingly, attendance monitoring. Do you think state hospitals need to beef this up?
I think one of the major concerns of the board is the unintended consequence to patient care. And we as a board have a duty to engage and advise the minister. And the board is considering advising the minister on this issue. So this is something that the board looks at seriously and will be engaging with the ministry about remuneration of doctors and about the applicability and administration of RWAPs, because we are concerned about patient care.
The issue of overtime and the 100 doctors in question there in KZN asking the government to pay them overtime when in fact they were not conducting duties at state hospitals but were working in the private healthcare system. Is this something that you're considering or concerned at least about?
We are concerned at those claims. But if you are a worthy employer and can administer your system properly, you will know that this is a fraudulent claim. And we would urge the provincial governments, if there's any act of fraud from any members registered with the Health Professions Council, they have a duty to investigate as an employer, to go through their employer-employee processes. And when those are completed and any practitioner has been found guilty of fraudulent behavior, they have a duty to report those practitioners to the Health Professions Council. And the council will deal with those issues as the Act expects us to do.
And what about criminal charges if those people are found to be guilty?
Well, we're not a criminal court.
Criminal
charges.
Would you hand them over for criminal investigations?
Remember, this is an employer-employee relationship. So the person that would have the duty to report any criminal activity would be the employer. Now, once the employee has gone through the criminal justice system and is found guilty, any practitioner registered with council that is found guilty of a criminal act, council then acts on those. Whether it's murder, whether it's robbery, whether it's fraud, any criminal conviction, we have a duty to act. So once a person has been convicted by the criminal courts, but that's an issue that the employer needs to deal with, they can then report that to council. If we become aware that any of the practitioners registered with council have been convicted of a criminal offense, we are expected to act, and we act. We will ask for the facts from the criminal justice system and do our duty properly.
Very quickly, we're seriously pressed for time. Do you know if any such investigations are in fact underway at the moment?
Well, we have been informed that at KZN they have advanced investigations. We're just concerned that we haven't had any practitioners reported to council for council to act.
We'll have to leave it
We
there. My
need to
apologies.
understand that.
Consider seriously pressed for time. We will come back and talk more about this particular issue. We'll find out whether or not there have been any finalities with regards to the investigations. That was Kgosi Letlape from the Medical and Dental Board, the doctor there within the Health Professions Council of South Africa. My apologies again, pressed for time.